Let's take a look at increased intracranial pressure. There are many ways in which intracranial pressure could be increased, and we've discussed this a few times. For example, if there's any type of hydrocephalus, that could be an increase in intracranial pressure. There are a few other important topics that we have to take a look at, including herniation, resulting in, once again, increased intracranial pressure. So there's a long list of differentials. But here, let's organize our thoughts and take a look at what happens. We have something called the Monroe Doctrine, and quote-unquote, brain in a box. So in other words, let's say that you have the box, which is then increasing the pressure due to whatever reason in the brain, increasing its pressure. The skull, of course, contains the brain, the CSF, and the blood, and so therefore any one of those in which it's undergoing, let's say, encephalitis in brain type of space-occupying lesion. We talked about hydrocephalus or perhaps even subarachnoid hemorrhage with blood. All of this could result in increased intracranial pressure. Then increase in pressure then displaces something, doesn't it? And that something that it displaces is going to result in whatever symptoms that your patient is going to experience. And here, let's say that our patient, remember we talked about subarachnoid hemorrhage and we talked about hydrocephalus. And with hydrocephalus, at some point in time, if it's left untreated, don't you think it's once again going to displace something? And that something that it displaces may then result in, quote-unquote, herniation. And that herniation is of different types. And all of this, of course, is going to contribute to the already existing increased intracranial pressure. So keep this, in terms of increased intracranial pressure, think of this as being kind of like a topic like headache, where there's a list of differentials. The same thing can be applied here as well. Now, herniation occurs when focal global pressure forces portions of the brain into the wrong spot. So what are these different types of herniations that you want to be extremely familiar with? You want to know about subfalcine herniation. Now, don't memorize this. What's sub mean? Underneath. What's falcine referring to? The falx cerebri. And for whatever reason, at some point in time, we'll talk about hematomas as well, right? We talk about hematomas, epidural, or you have your subdural. So you can have those type of hematomas. So remember, please, that you could have a trauma resulting in hematoma, and also at the same time, there could be displacement of the brain parenchyma in the wrong spot. So imagine now that you're the medial hemisphere of the brain, and you just got hit by a baseball. Boom! And now you resulted in, let's say, a epidural hematoma. In addition, let's say that the medial hemisphere of the brain is now moving underneath the falx subfalcine to the wrong spot, to the other side. Guess what's going to happen? Continue with your story. What story? What's the name of a blood vessel that is supplying the medial hemisphere of the brain? Aha! Anterior cerebral artery, right? Anterior cerebral artery. And the medial hemisphere of the brain is supplying what part of the body? Is it my face or is it the lower extremity? Lower extremity. So with the subfalcine herniation, it could result in lower extremity issues. Clear? It's all a story. All that you're doing from neuroanatomy is memorizing the facts so that you can apply the proper pathology and the disease so that you tell a story. Otherwise, you're wasting your time. What about uncle herniation? What's uncle refer to? The uncus. Where is that? Oh, yes, anatomy. Temporal. Good. So another name for your uncle herniation is known as transtentorial herniation. What is that going to do? It's going to press upon the brainstem. Brainstem. The temporal lobe, uncus, pressing upon the brainstem. What am I pressing upon? Third cranial nerve, oculomotor. What happens? You lose your parasympathetic, you have uninhibited sympathetic activity, blown pupil. Or you could have tonsillar. What does that mean to you? What tonsils am I referring to? Cerebellar tonsils. And these may herniate into where? Foramen magnum. topic, increased intracranial pressure. But at the same time, remember, there are many pathologies that could occur at the same time, giving you different presentations. You just have to be very careful as to what exactly is the clinical picture, so then you can choose the appropriate step of management.